Welcome to My Brain Mechanic podcast, solely dedicated to traumatic brain injuries and other neurologic conditions. What I want to discuss today and share with you are the 5 hidden dysfunctions that are all well established in the literature, but are being completely overlooked and have never been connected until now. The first is microglial activation, the brain's immune system, and neuroinflammation. And I separate them for a reason, and each podcast will break down each dysfunction. The second is a breach to the blood-brain barrier. The third is dysfunction with the gut-brain axis, causing a bidirectional inflammatory loop. And the fourth is damage to our 400-mile-long microvascular network that not only gets damaged, but weeks and months after an injury gets calcium buildup in the capillaries that slows blood, oxygen, nutrients, and metabolic waste removal from happening. And there is no drug to remove calcium out of the capillaries. There is no drug to rebuild a healthy microbiome or seal the gut. There is no drug to seal the blood-brain barrier, and we can look at the causes of neuroinflammation and some of the different side effects that drugs may have. Now, I am not anti-drug. There are some incredible drugs out there for seizures, for treating symptoms. There are also some phenomenal rehabilitation clinics that do speech therapy, occupational therapy, physical therapy, other modalities in medical devices that can do a lot. But unless we address these internal dysfunctions, we will never truly turn the page. And what makes me such an expert? For almost 2 decades, I was the global educator for metagenics in the Institute for Functional Medicine in 24 countries. And IFM is like the Harvard of functional medicine. It's where doctors and practitioners would go to get certified and learn and implement functional medicine into their Western medicine practice. But in 2014, all that changed, and I suffered a severe traumatic brain injury. My comeback is a long story, but the standard of care was treating symptoms, and it was functional medicine that brought me back. And I dedicated my life to figuring out why, in some cases with moderate to severe TBIs, upwards of 40 to 50% of people are the same, worse, or have passed after 5 years. And when I opened my brain mechanic, it was named my brain mechanic because instead of treating symptoms and looking at the exterior, we had to open the hood and look at the engine, the transmission, the electrical system, the whole thing. And your brain is the Ferrari of all of our body parts. And a Ferrari has a unique electrical system. It has its delicacies, its vulnerabilities, but it is also the most beautiful and powerful car. But it needs somebody that understands that, and that's what I've devoted my life to. And as the Brain Injury Association of America started to recognize and recommend me, and I started to build patients in 4 countries and see not just cognitive changes in anxiety, depression, memory, irritability, but physical changes in walking, speech coming back, vision restored. I knew I had discovered something, and this is not a replacement for anything that's out there. It's an adjunct therapy. It's the missing pieces to this puzzle to finally make a change in recovery that we have not seen in decades. So in the next podcast, We're going to focus on the brain's immune system and transcriptomic reprogramming, what that means, how we can change it, and the other causes of neuroinflammation. So I'll see you soon.